Welcome to the CHIME Opioid Action Center podcast, where healthcare leaders explore how technology is making an impact in the fight to end the opioid crisis. Here's today's moderator.
Hi, I'm Bill Spooner, a mostly retired former CIO, and I'm co-chair of the CHIME Opioid Task Force Technology and Interoperability Subcommittee. Today, we're talking with Krista Lokan of Virtua Health. I first learned about Virtua Health's journey as part of the level 10 validation of Virtua back in October of 2023. Virtua is one of the less than 24 organizations that achieved the top of the heap level 10 digital health most wired status. When we were doing the validation, they presented to us this workflow about how they use this app connected to Epic called FindHelp to refer patients in for treatment. And so we're going to talk about that with Krista for a minute. Krista, welcome. Thank you for being with us. Why don't you start by telling us a little about yourself and then a little about Virtua Health?
Thanks, Bill. I'm happy to be here to talk about some of the great things that we're doing at Virtua. So I'm Krista. I'm a population health architect here. I've been here for about 10 years in various roles. A little bit about Virtua. We're a comprehensive healthcare system here in southern New Jersey. We serve primarily Burlington, Gloucester, and Camden counties. We offer a wide range of services. We have 5 hospitals, primary and specialty care. We also have a fleet of mobile vehicles, which go into our communities and are able to offer some incredible services like extremely reduced cost food and even mammograms. We also have a clinically integrated network, and we partner with our community organizations and institutional organizations. We also have a school of medicine, the Virtua Rowan School of Medicine, and we really collaborate with external community-based organizations to try to promote access to healthcare services and promote overall health within the area.
Well, we know that substance abuse is a nationwide problem, but there are nuances in almost every community. So I'm really interested in hearing a little bit about your area. Do you think you're worse than others? Are you better? Do you have it solved entirely? What's the situation like in Marlton, New Jersey?
Yeah, so we don't have it all solved. I'd like to say that we do. Each of the areas around us has a very specific set of challenges. It's very different from one area to another. In Camden, New Jersey, you have different challenges that you might have in Cherry Hill, New Jersey, and there's only a few miles between those two cities. So at Virtua, we do have a very robust care management platform where we have multiple different teams, both inpatient and outpatient, working different programs for different subsets of patients to try to tackle some of those issues in different areas. And a lot of that is work with social determinants of health and just in general health equity, and substance use and screening for substance use really comes into play there.
So if a patient comes into your or is brought into your organization, into your ED with an overdose, what happens? And how does this FindHelp app that you folks have put together with Epic help you in their treatment?
Yeah, so basically what we have is, and for instance, in any of the care management programs that we're working, even if a care manager is not specifically working with substance abuse patients, but while they're talking to the patient, they hear an opportunity or an opening that patient is struggling with substance use. Having this platform of FindHelp to pull up right within the EMR and place a referral in such a timely fashion that it's almost as if we're placing an internal referral is priceless. So what we have, for instance, is our care management framework. We have real-time reports. So for instance, for substance use, we have a program with the state called Quality Improvement Program New Jersey. It's pay for performance. It's aimed at Medicaid patients for maternal and behavioral health. And we are essentially on the hook to follow up with some of these patients who do come into our EDs and screen positive, or who are there with diagnoses that are tied to substance use. What we have are specific groups of outpatient care managers who have a real-time report within the EMR that we build them, where it returns a list of patients who meet the criteria. And then what we've built out for them is essentially a framework where they open an encounter, and through FHIR technology, we're essentially able to create a profile for the patient and place referrals directly from within our EMR to these external community-based organizations.
So what was it like before you had the tool?
Yeah, so and that has been such a problem, and that's kind of why we started to explore FindHelp and why we needed to tackle an electronic referral system, because all of these different teams were maintaining their own sort of spreadsheets or email folders of different resources, and that's an age-old problem. That's the hours are going to change, patient program eligibility is going to change, your personal contact at an organization leaves, now there's a communication delay. So it was that very manual piece of sending a fax, making a telephone call, the inefficiency of the back and forth between us as clinicians and these community-based organizations.
So can you talk a little bit about the acceptance of this workflow and the tool, both from the perspective of your community organization as well as the patient?
Yeah, so adoption, like I said, has been a little challenging. This is a great tool, but it does have some challenges because it is hard to bring everyone onto a platform when they're used to using their own resources. So essentially what FindHelp is, for those who may not know, is it's a community resource database that's maintained primarily by the vendor with the help of the community. And then additionally to being a community resource directory, it actually allows organizations to sign up for the platform so they can receive referrals directly. And then, because this is a hub, it's not just Virtua who uses this, it's also used by other hospital entities in our area, like Cooper. It's also used by other community-based organizations. So there's a lot of eyes in our area that are on this platform that really allow us to get the most use out of it. So from the patient's perspective, it's a priceless tool. It's an up-to-date list of resources for basically any need that you may have. It's fast, it's discreet, and they can either browse anonymously or they can create an account to track their communication and referrals. And then from the clinician's view, one, it's efficient, and because we have that FHIR integration, it's real time, it's right within the EMR. So it's up to date. It tells you qualifying, eligibility, hours, next steps. There's no faxing, there's no paperwork. It cuts down on those communication delays. And like I said, it's real time. So it's as seamless as placing an internal referral to place an external referral. And then even from a technology standpoint for us, from the IT end, it keeps us from having to maintain our own database, which would be impossible to try to keep up with all of the community resources in the area. And it obviously cuts down on failed faxes for us as an organization. But the other piece here, which is both, for us from a technology standpoint, but also from an operations standpoint, is the analytics. So we can really dive into the data behind FindHelp to see what our patients are looking for, what our staff is doing, what organizations are we reaching out to. And then we can tie the data that's about the patient from FindHelp to the patient's overall EMR medical history. So we can create a story about the patient.
So and I think you said if a newly formed organization wants to participate, they can sign up and be added to it so the patient can find it. Can a patient express their preference? I'd rather go to a place that does medication assistance, or I'd rather be attached to a faith-based treatment organization.
Yep. So that's exactly one of the great things about the platform is all of those, I guess you'd call them identifiers or criteria or keywords, are all right there. That's part of what's maintained. So if you're looking for a faith-based organization, you can choose the faith-based organization. You can really browse through the list of resources to see what best suits your needs. If you're under 18, over 18, if you're military, if you're veteran status, all of those things come into play. And the application makes it really easy to search and find what you're looking for.
If I refer a patient, or if you refer a patient to one of those treatments and the patient doesn't go there, do you find out about that?
Yeah. So yeah, absolutely. So within the EMR, because of the FHIR integration, and for those who may be listening who aren't that familiar with FHIR integration, it stands for Fast Healthcare Interoperability Resources. It's a standard framework, almost like an interface, but it's sharing data from endpoint to endpoint. So what that integration actually does within the EMR is it passes data from the patient's chart into this separate FindHelp application. And when it does that, it's actually creating a profile for the staff member, where the staff member can track all of the work that they've done and all of the referrals that they've done for each patient. And there's also a profile for each patient. But what happens is, as part of the care management workflow that we have for the different programs, they are tasked with follow-up tasks. So they will follow up with a patient in 2 weeks, in 3 weeks, whatever the program dictates, and they can see what the referral status is. So did the organization accept the referral? Is it waiting on the patient? Did the organization try to reach out, but the patient hasn't reached back out to them? So there is a way for staff to actually see, what's actually being done.
So you're an Epic organization.
Mm-hmm.
If a patient is referred through FindHelp, does that somehow get recorded into so that they can see it in my chart?
It does. So we actually have 2 FindHelp websites. So just to give a little background there, we have a patient-facing website, and this is where patients can search for everything themselves. This is just something we offer to everyone. So with that website, we link out to that in our patient portal, which is my chart. So we can see, come the end of the year, there have been 9,000 clicks on the patient-facing website from within my chart. Of those 9,000 clicks, 200 of them, the searches were for substance use disorders. And then of those 200 searches were any referrals actually placed for substance use disorder. So that's one piece, is within our patient portal, where we can see that data. But we also are tracking it through QR codes. So we link out to that patient-facing website from a QR code that we add to our emergency and inpatient after visit summaries. And that has just a generic blurb for anyone searching for any kind of resource to basically say, hey, you can go here, you can create an account for yourself, and you can search for or create referrals for yourself or others.
Very good. You mentioned that you're not the only subscriber to FindHelp.
Mm-hmm.
Is there a regional effort so that you really are collaborating with your neighbors in terms of how you're treating that population?
We really are. So, at Virtua, we have a great health equity department, and I do want to give a little shout out to someone who I know will be listening, who's our director of health equity here. His name is Daniel Master. And that department is really the operational stakeholders and have been the reason why the use of this is so successful, because they're not just looking at it from how do we use it at Virtua and, from within the walls of our organization, but how do we use it in the community? So they do pull together these alliances with other organizations. So yes, working with Cooper Hospital, yes, working with these specific organizations in the community that we use the most, but also when we're able to leverage that data that we're seeing from FindHelp, it offers other opportunities. So for instance, the city of Camden, which we talked a little bit about, we've reached out to them, our health equity team has reached out to them and started to have conversations about getting them on the platform, right? So then at Virtua and whoever else is using the platform could at some point then place referrals 4 city-run programs directly through the platform. So the whole effort to really improve access to these resources in the region is like full speed ahead. Very impressive stuff being done by our health equity team here. Yeah.
Well, congratulations to them. It's a community.
Yeah.
So I didn't really ask you how long it's been in place there, and what kind of measurements do you have to decide whether it's successful or how successful it is?
So we have had it in place since 2020. Adoption of it hasn't been easy. Like I said, our Dan Master and our health equity team really needed to come in and cheerlead its adoption across the organization. So the way that we're measuring success from it is really specific to the programs that we're using it primarily for. So for Quality Improvement Program New Jersey, which was that substance use specific workflow I was talking about earlier, what we do is, because we're documenting all of that, we have to document our outreach and our attempts at providing those Medicaid patients intervention. We're able to pull data from the databases from both Epic and FindHelp, because through that FHIR integration, we're passing the MRN from the patient's chart into FindHelp. So we're able to pull that data. We have metrics, we have comprehensive care management outcomes dashboards where we're tracking, program specific outreach that way. So that's more looking at it from the EMR and the overall, framework, care management framework, but specifically from, the use of the tool. FindHelp does provide comprehensive analytics. We have a Power BI database that really is just looking at all of that data and from within FindHelp, and we try to tie that into our overall health equity strategies here and that work that these teams are doing.
So in asking this question, I risk the answer being all of it, but tell me what you're most proud of.
Oh goodness. Honestly, it's that work of knowing that it's helping the community as a whole. So it's great to do things that are specific to you at Virtua, us at Virtua, to the programs that we're doing, but knowing that we're having that outreach in the community to other community-based organizations, knowing that we're offering this to patients even outside of the work that we can do on behalf of them, that's a great feeling, because that it's being utilized. I can see that it's being utilized in the analytics that we're seeing. I've used it myself. I've referred it to, my friends. It's a great tool, and it's really had an impact on the way that we can, offer people help. And that's a great thing.
Absolutely.
I would just say, if anyone out there listening wants to talk more about this, feel free to reach out to myself. I'd love to talk about it, or even connect people with some of our operational leadership who really runs all of this behind the scenes.
Yeah, and can you share your email address?
Sure. My email address is klokan@virtua.org.
Very good. Well, I really appreciate the time that we spent today. This has been, I was excited about it when I visited you a few months ago, and I'm even more excited today. And I really appreciate your willingness to share this with the community at large, because that's how we make improvement. So I'm very grateful.
Thank you so much. I appreciate it.
Thank you very much for your time and your insights today, Krista. This has been very interesting. And thank you everyone for listening to the CHIME Opioid Action Center podcast. And please visit the opioidactioncenter.com website for this and other episodes. And also, Krista shared her email address if you'd like to reach out to her for more information. Thank you again. Take care and be safe.